many of the early changes cannot be easily or readily visualized, especially when surgeons decide the surgical margin in the operating room. We have a new device developed from BC, and we have been using that to observe the oral lesion extension of premalignancy and the cancer. It's a blue light. It's not fluorescence light, not UV light. It's just a white light using a filter. Only the blue light can pass through, and so it's no harm to the body. And so when we shine the light to the tissue will automatically generate a color called tissue autofluorescence. It's shining as a green color. So when we shine this blue light to tissue, if it's normal, we'll have a green tissue autofluorescence. So we can observe this green light. And if it's abnormal, it will lose of this green light, so it will show dark. So dark and the green, so easy to distinguish. Then mucosa usually red, redder, pink. It's hard to distinguish to many of the clinicians' eye. With this device, and we can see those clinically not apparent change that we can decide a better margin. It's not to cut a wider area, but it's better area. For those areas need to be cut, then we remove, but not, so we don't do overcut or undercut. Head and neck surgeons are willing to adopt this technique in changing their practice, because currently they just use their naked eye to decide the surgical margin, and this is really revolutionized the way how they visualize the lesion and do a better surgical treatment. Green tissue autofluorescence that indicate the normal tissue. If there's abnormal change, for example, cancerous tissue or precancerous change, that we might see loss of this green tissue autofluorescence, and then we can clearly see the extension of those diseased tissue.
What we've done here is we've used autofluorescence, which is the excitation of the tissues with a monofilter light to help demarcate the surgical margins. Conventionally, what we would do is use white light magnification. What autofluorescence allows us to do is add a new dimension to detect abnormalities which may be histologic or perhaps only genetic, and use those in a real-time way to evaluate surgical margins.
What is it that makes you guys winners year after year after year?
Very honored, very honored. Well, I think a lot of it is dedication to the cause. We really believe that what we're doing has an impact in terms of saving lives, and it's that commitment to helping our dentists and helping the dental communities provide a service for their patients that finds a way hopefully to improve, and from that hopefully has a way to impact the industry in general.
Well, LED has been doing a lot of really important work, so congratulations on this and keep up all the good work that you guys do.
Thank you very much.
Thanks for joining us.